Hey folks, this is Ray Kober. If you haven't done so already, please click that subscribe button below. That'll help us get better guests and make the show better for you. So once again, click that subscribe button, join us for this journey, and together, let's make healthcare better for everyone.
Get ready to take control of your healthcare. Here's your host, Ray Kober.
Let's talk about the roots of ELAP, which really was a pioneer in reference-based pricing.
Yeah, so Stephen Woody had ELAP, which they founded, and maybe it's about 8 years ago, took an investment from a private equity group called Water Street Health Partners out of Chicago, very healthcare focused. I think for Stephen Woody, it was a way, one, to recognize the efforts they had put in and get some liquidity, but more importantly, to help them grow and scale that business. And it was primarily ELAP doing reference-based pricing, and they really were the founders of that, trying to not just reprice at a different level. You know, the theme was Medicare plus 20, cost to charge plus 12, the greater of those two. It's usually 140% of Medicare on average. That foundation allowed them to save a lot of money for employers, and so anywhere between 20 and 30%. And it's easy to reprice. It's hard to hold the line and defend those reimbursements. And so they had a pretty sophisticated way of supporting employers and members if the provider decided they didn't want to take 140% of Medicare. And that DNA is still with us today. I mean, at the core of what we try to do, whether it's out-of-network claims, whether it's in a dual option where you can have a broad panel PPO product and offer an RBP product, the ability to make sure that members can consume care and have access to care. Like the two biggest things you hear about reference-based pricing, we all know this, right? It's you'll never be able to see the right providers. And on the back end, they're going to balance bill you and hassle you and debt collect you until you acquiesce. And, you know, while that can be true, the percentage of times it happens is so minimal these days, and we manage it probably better than anybody out there, that I think it's worth re-looking if you haven't looked at it as a broker or as an employer or a CFO or a CEO. It's worth reinvestigating where reference-based pricing is today versus where it was when Steve and Woody founded the business.
So,
you know, from a CFO perspective and a broker perspective, say, well, they're so convinced that this is going to work and we're going to save money that 125 is not going to happen. They're going to buy it down to 110, and they'll underwrite you between 110 and 125. So you can set everything at 110, and that's going to create savings and first-year improvement, and also hopefully have a little bit of bank to take into the following year and some reserves you can use and lean into without ever having any control over this. That's the big thing is, you know, you had a checklist before we got going today,
Yep.
right, with a lot of things on it. And I'm sure you didn't do that. That's not the first time you did it. And I thought it took, and right, it's taken,
Right.
You've had a lot of, boy, I wish I would have done this. I wish I would have done that.
Right.
And got to a point now where you're like, all right, I know what I know. This is the method. This is what I do.
Yep.
There's no difference in when you buy healthcare,
Yep.
health insurance.
Yep.
You need a 3-year plan of attack. And if your goal is to recruit the best people on the planet and you don't care about anything, any cost, buy a PPO. Do it fully insured.
Right.
Everybody will be happy.
Right.
Hospitals will love you because you're going to pay them really well. Brokers love you because you're going to get a nice commission. I mean, it's a wonderful product. It's just I can't afford a private plane and I can't afford a lot of things, and I have to figure out how I can afford for our company at Imagine360. We're on it.
Right.
So we are on reference-based pricing. We have direct contracts. We administer our own benefits. We have our own captive, so we insure ourselves.
Yep.
And that's what we can afford as a company. Mm-hmm. And we've seen our renewal increases steady in the, you said 10%. I know that's the norm. But, Medicare has been increasing at 2 or 3% a year.
Right.
And since that's our benchmark and how we reimburse on a lot of the services we provide,
right.
we see probably 3 or 4. And for our company and for a lot of companies like us, we work with a lot of auto dealers and transportation companies and surprisingly, a lot of healthcare groups. Mm. We have several hospitals we work with, doctor groups, because they kind of understand the way this crazy healthcare thing works and the reimbursement methodologies that are out there, and the fact that they don't want to be the ones that are overpaying, because they know that in that broad panel PPO, when you're discounting off of bill charges, it's a winner for the hospital systems. And why do small, mid-sized businesses have to be subsidizing hospitals, P&L?
Right.
They shouldn't. I mean, the unions don't.
Right.
Right. Many times, a lot of the Taft-Hartley plans are not. They've done some direct contracting and some pretty creative things. The ACA doesn't. Right. When you buy an ACA product, that reimbursement's substantially lower and tied closer to Medicare and Medicaid, somewhere in that range. It's only the self-funded commercial market that is paying the highest freight, and I don't think it's fair.
Tell me a little bit about, the ugly side of the early days, and then when did you come into the picture, and was it just kind of a changing of the guard, or was there a real mandate with hiring you as CEO to come in, and what did you walk into?
Yeah. So I started in 2019, and it was probably 3 years into Water Street's investment, and I was really taken with how successful they had been with what seemed like in a very impractical approach. And when I looked at the numbers and saw the data and kept asking questions, it validated the fact that this is a different but very successful way of going about reimbursement. And they were on the cusp at that point of just bought a company that had a lot of direct contracts called Imagine Health. Ironically, when we rebranded the business a few years later, we made it Imagine360. But I think in the early years, it was, a bit bare knuckle. We strenuously defended the reimbursement, and we didn't have a lot of yield, and we had a lot of conviction that we were doing the right thing for the employer. That it's American families deserve better, and we're going to bring fairness back to healthcare, and we're going to advocate for the employer on their behalf, and we're not going to yield, and that worked because what that did is it put a framework in for the company to handle the worst situations, because there was no yielding, and so you are actually having a lot more of those, because of the unwillingness to negotiate, unwillingness to pay small dollar balance bills out just because let's make life easier for folks. Not having direct contracts originally. Yeah. And we debated, right, as a management team, why would you ever want to do a direct contract? Because here's what's going to happen. They're going to bring you in at a low rate, and then 4 or 5 years from now, they're going to jack the rates back up, and they're going to have you because you've just told all your employees to go there and all your clients, and you're going to be right back to where you started. And so we debated that a lot, and there were some people on the team who said we should be a pure play RBP company. That's it. But ultimately, I think the power of the and. You can be a great reference-based pricing company, and you can have direct contracts. And you know what else you can do? You can offer a dual option. Yep. So you could give employees who can afford a broad panel PPO the broad panel PPO. Right. But why tax everybody else in the company, particularly lower wage earners, with that very expensive, to your earlier point, that fully insured mindset where you're paying for a Cadillac or private air service when you should be in Southwest, right? Or be in an Uber. Yep. And so who are we to tell people what they can afford? We're just going to create an environment where we can give the lowest cost product that's available to the one that could be the highest. So we, 2019, I was hired to come in. The founders were still active in the business, and I really wanted them to stay on and with me and help me get to know the company better, and they did. They were both on our board, and for the past 5 years, they've been really active.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.